Welcome to Roadmap to Residency, Evidence-Based Application. In this video, we will be discussing few questions on patient safety. So, which of the following is the most appropriate course of action? Let's go through the question. An 82-year-old man with a history of advanced Alzheimer dementia is brought to the hospital by his daughter, who is his, who is his power of attorney and caregiver. She says that her father is increasingly confused and verbally aggressive. He is admitted to the hospital and found to have a urinary tract infection. IV antibiotics are initiated, and he appears less disoriented and agitated, but remains unable to recall nursing instructions throughout the day and is fairly nonverbal. 3 days into his treatment, the antibiotic order expires and is missed by the physician, nurses, and pharmacy staff. The patient receives no medication for 2 days before the error is noted and corrected. There are no consequences to this error other than extension of his hospital stay by 2 days. Which of the following is the most appropriate course of action? Do not disclose the error as the patient was not harmed. Do not disclose the error but arrange for the hospital to not charge for the extra days. Inform the daughter and disclose the error with an apology. Inform the patient and disclose the error with an apology. Say nothing until the incident is discussed with nursing and pharmacy staff. So these sort of communication questions will be there, and there will be a lot of questions on communication in your examination. So uh, you need to be pro in these sort of questions. So medication errors play a major role in patient morbidity and mortality, particularly in the hospital setting. These errors may be caused by healthcare professionals or factors related to the medication and factors related to the patient. Quality improvement measures such as checklist or medication reconciliation to attempt to minimize these preventable errors. It is often challenging for physicians to disclose when medication errors have occurred, particularly when no serious harm has come to the patient. Reasons for this reluctance may include fear of litigation or loss of patient trust and confidence. However, full disclosure of medical errors should occur in a timely manner and has been associated with a neutral to positive effect on patient response and the physician-patient relationship. When an error is noted, a disclosure should be provided in person in a timely manner that includes an apology of what occurred. Now, because this patient's altered mental status and advanced dementia prevent him from being able to understand what occurred, it would be more appropriate for the physician to disclose the error to his daughter. Okay. Now, over the next several months, this is the sequential of the same question. Now, over the next several months, there are more cases in which expired medications fail to be renewed. Finally, a patient on IV dobutamine for decompensated heart failure does not receive the medication for 6 hours and experiences worsening of her condition with resulting hypotensive shock. Hospital administration convenes a committee to address this incident. Which of the following is the most appropriate next step in addressing the problem? Create an alert system in the electronic medical record to notify physicians when orders expire. Have a second pharmacist double check expired orders. Increase the hospital's risk management staffing. Interview pharmacy, nursing, and medical staff on the units where this occurred. Interview the patients who experienced adverse outcomes from these medication errors. So, the first step in the root cause analysis involves collecting data to obtain complete information about the events. This involves interviewing multiple staff members involved to understand why and how the adverse outcomes occur. For example, interviews may uncover the root causes such as understaffing in the pharmacy stemming from budget cuts or a hostile hierarchical culture that led nursing staff to be reluctant to point out problems to the medical staff. Here is a full communication question. So which of the following additional statement by the physician would be most appropriate? Let's go through the question. A 52-year-old woman undergoes a fine needle aspiration procedure for evaluation of a thyroid nodule. The physician completes the biopsy successfully without complication. However, a week later, the physician is concerned because no pathology results are seen in the electronic medical record. Upon contacting the lab, the physician learns that the specimen were never received. Now, the patient inquiries further among the staff and learns that the staff member normally in charge of transporting the specimen was absent the day the procedure was performed, and the temporary off-site assistant had filled in for the staff member. The patient is scheduled to come to the office the following day to receive her results. After informing the patient of the need for a repeat procedure due to sample misplacement, which of the following additional statement by the physician would be most appropriate? Please pause the video and go through the options. So answer is C, and that is I apologize on our team's behalf for this error. We will waive charges and will identify ways to improve our specimen tracking system. So error disclosure to the patient. Now this is very important, very important concept to know for the examination. First, we need to describe the error. For example, unfortunately, the biopsy sample was lost and a repeat procedure is necessary. Then they need to explain why the error occurred. For example, the lab never issued the sample, possibly due to a tracking or staffing error. Then we need to express regret or apologize for the error. I apologize on behalf of our team. Then we need to describe the steps to minimize consequences. We will waive all the charges associated with the repeat procedure. Then the outline actions to prevent future recurrences. I will notify our administrator now for this error and we will change our procedure so this does not happen again. Now this is the last question for this video. Which of the following actions by the intern is most appropriate? A medical intern is working on the inpatient wards at a busy community hospital. During rounds, the team evaluates a new patient admitted for worsening congestive heart failure. The patient's past medical history includes atherosclerotic coronary artery disease, diabetes mellitus, and pulmonary hypertension. Current medications include metformin, aspirin, and enalapril. On previous admissions, the patient admitted to using cocaine recreationally with friends and admits to the intern that his last use was today. The attending physician asks the intern to start the patient with preventable for his heart condition. He will be expected to continue this medication from following hospital discharge. After rounds, the intern recalls that during medical school, she learned that the beta-adrenergic antagonist can interact poorly with cocaine. Which of the following actions by the intern is most appropriate? Please pause the video and go through the options. So the answer is E. That is, do not order the medication until discussing concerns with the attending physician and asking how to proceed. So, it is the best interest of both the intern and the patient to resolve potential problems before proceeding, and this concept applies to the relationship between residents and attending physicians, physicians working in parallel, and medical students and other medical staff. The best approach is to respectfully discuss the issue directly with the attending physician and inquire why the decision was made in this case. Thank you for watching. Keep it strong.